Hello. Hello, everybody. Good afternoon. How are you all today? Thank you all for coming back. I know this is a little refreshment break time, but I really appreciate you all coming back in here and join me in discussing how we can focus more on personalized healthcare and really work together on trying to bring back this emphasis on relationship-based care to leverage and use technology as well as individual connection in this new era that we now live in, which is the COVID-19 era in this pandemic. So as we talk about relationship-based care, there is this quote which I very much relate to with the concept and the approach that I started NeuroBloom, the company of physical therapy and wellness with. What we are trying to strive here with NeuroBloom Physical Therapy and Wellness is to have and create a wholesome experience for our patients in the moment, where we're focusing more on the human being connection with each other, the provider and patient connection with each other. We are trying to bring together this connection in this COVID-19 era where the care is more conveyed through touch, through a kind act, listening to our patients, having that individual connection, forming a relationship, and trying to understand the experience that they are going through so that we can create a wholesome healing experience for our patients. And this very beautiful quote that was written by Mary, and this is exactly something that we are trying to encourage here in the company with NeuroBloom and what we're trying to strive and bring it out all together. What are our needs for today as we speak for bringing this relationship-based care? Why is this so important? Why do we need today? And why do we need to redefine, reimagine this concept of bringing in the healthcare system? With the unprecedented changes that has taken place with COVID-19, it is extremely important that we revisit, revise, and come together to reimagine what a patient-provider relationship and what that visit should be like. It could be through virtual care, it could be through digital check-ins, it could be through in-person care, be it in the form of concierge physical therapy, which is what NeuroBloom Physical Therapy has now started with this whole concept based on providing and taking this care to a new level, providing door-to-door care to our patients, trying to cater their needs as to what they need, when they need, especially given in this environment where we had a shutdown with the government where our patients did not have access to the gyms, to the traditional methods of having access to clinics and departments and outpatient departments and having access to coming and seeing the providers at these traditional methods and models of healthcare system. So how can we provide this care better to them? How can we take it to them? Through concierge physical therapy and through telehealth physical therapy, this is one of the ways where we can try to redefine this relationship-based care, where we're shifting this transactional model and bringing it to a whole new level of redefining the relationship-based care. Now, when I say what are our needs for today and what is this relationship-based care, this is how This is how I look at it. This is how I envision for NeuroBloom Physical Therapy. This is how our team envisions. This is what our perspective is. To reimagine what this visit should feel like. To bring in the current opportunity and focus more on not having so much emphasis on volume metrics or documentation requirements, or what should it be for how much do we need to get reimbursed, or how many patients do I need to see in an hour, or how much can I do so that I can move on to my next patient. We're trying to create a relationship-based care, which can be bi-directional, multi-directional, creating an empathetic response, fulfilling this relationship, facilitating health and well-being in the true manner. These are the 4 fundamental roots of relationship-based care, which NeuroBloom feels are the whole heart and soul of creating this holistic experience as to why we need to place more emphasis on this relationship-based care. Starting with people-based care. What is people-based care? Why should we focus on this? Taking the time for people-based care to review the pre-assessment process, the intake process, taking the time to review our patient information before they even come and see it. So at NeuroBloom, when I'm seeing patients, when they're coming to see me at their initial session, I already have a history from them beforehand. The team connects to get the history, to get what they need, what their needs are, providing initial consultation care, phone calls, understanding what that visit is going to be, giving them the opportunity to have questions ready for me, to have their concerns for me that they can come and discuss with me during their initial session. Trying to create this healthcare system and focusing more on people-based care versus trying to make it one-directional. As we talk about making it bi-directional, trying to have people connection, provider connection, and making sure we're engaging together to focusing strengths and needs and what their past experiences and their failures have been, taking that into consideration and designing their care plan, which we call as the NeuroBloom Care Plan, a complete holistic NeuroBloom care pathways, trying to take these into consideration versus the traditional model of healthcare providers, where the providers have great skills, they have great knowledge, they're great problem solvers to treat their patients. But starting that care off with focusing more on the patient's strengths, their life journey, their experience, because they know more about their diagnosis. They know more about their life, their experiences, what they're going through, their diagnoses. So having that ear to their problems and just focusing more on what they are here for and creating that wholesome experience of provider and patient relationship, such that we are striving here every time they come to see us to make a full experience for them and target on each and every need. When we talk about the holistic care with holistic focus with integrative care, for example, I have patients where I'm treating where they talk to me about a particular diagnosis that they're coming to see me for, a stroke, multiple sclerosis, tumors, cancers, whatever their diagnosis is. Here's what we're trying to do at NeuroBloom. Not only treat them for what their diagnosis is, but providing them that complete round care all the time through digital check-ins, making sure that we are following up with their care, pre- and post-assessments and evaluations and treatments, following up through available for them when they need us through text messaging, using that digital care, especially in the COVID-19 era, where we do see that patients have access to urgent cares and ERs for medical needs, but not for physical therapy. What if they need to reach a physical therapist for their ongoing care and being able to reach us using digital platform and using digital technology to reach us when they need to. Having those wellness classes that also NeuroBloom teaches, which is an addendum which creates like a following and a maintenance therapy that goes on, even when they get discharged from their actual concierge physical therapy, where we're focusing on integrating their complete health and wellness by maintaining their balance, their mobility, and if they want to see us for any of their continued care of vestibular issues, weight loss, post-procedures, wellness issues, and fitness issues, where they want to focus more on decreasing falls in the community, becoming more safe in the community, and having that independent life. So we can take them, we can carry over whatever they learned in their physical therapy and transfer it to their community, into their functional life, so we can help them become more independent in their activities of daily living, like shower, bathing, dressing, making sure that they're able to tie their shoes, wear socks, dress their upper body, dress their lower body, being able to cook, being able to become independent again in the kitchen, in the garage, where they need to be. Helping them carry over those learned skills from that environment that they learn in physical therapy and taking it into their concierge care and telehealth care and taking it into the environment where they can now become independent with instrumentals of daily living, which we call as IADLs, where we can help them become more independent in the community, in the grocery stores, return to sports if they need to get back to certain activities that they desire to, get back to work, get back to life. Because that is what physical therapy does, and it strives for the profession as a whole. And what we're doing in NeuroBloom is taking that concept to a step ahead, to a new level of providing that care and encouraging that care through being available for our patients and creating that personal relationship with our patients, to have that provider-patient-clinician relationship at all the time. However, there's always a but. However, realistically, as we talk about what the relationship-based care is, what our vision, what our mission is, what we are striving to be at NeuroBloom, these are some of the examples, some of the very few examples that we see, which are unfortunately some of the barriers to the growth that we see in our ongoing traditional healthcare model in our system that we see, where we talk about our clinicians are the experts, our patients are expected to be compliant to what the procedure is, to what the definition is that's given, to what the treatment plan that is designed for them. We have to follow the electronic health records and electronic medical system records. We have insurance industry. We have third-party people where we're trying to bring all this clinical level and clinician level together. We're trying to maintain that provider care together. However, what we're seeing is a lot of increased time which is spent on these documentation systems, leading to higher burnout rates in the providers. We're seeing sometimes that a lot of use of a technology with respect to the digital care and the digital platform. And we're also seeing that together, are we spending too much time? Are we having to put in together all this work, all these efforts to get reimbursed? Are we having to limit the number of patients that we're seeing to follow a certain system that's pre-written? And is that compromising our patient care? Is that compromising our quality? Is that high burnout rate that the providers are facing today, is that shifting their focus from seeing the patients and creating that whole experience for them? Is it leading to a shift of their focus on counting the number of patients or having that volume of patients that they can see in 15 minutes or 20 minutes? Are they being burdened to meet the productivity requirements of of the hospital settings, or of the documentation system settings, of the health record system settings, of the insurance industry? Are we all being burdened by that? Yes. And that is what we definitely see as some of the very barriers to the growth that we are very pronounced, that we're definitely seeing with our healthcare system today. However, there came a pandemic. We're very much in the middle of it right now as we speak. That's what it took. It took a pandemic to reflect on this practice. I still remember the day we had this news started coming out about there's a virus, there's COVID, there's this coming out, it's going to be a pandemic. Things started changing. And before we knew, this whole healthcare system was about telehealth, telerehab, telemedicine. We cannot go to the doctor's office. We have to wear masks. It's dangerous. It is not safe. Everything changed overnight. More focus, more transformations. Everything started changing. The communication system started changing. The healthcare system started changing to meet these unprecedented changes. And we're still very much in the middle of these constant changes in the healthcare system. Using these digital methods to transform these human connections is what we want to try and use to optimize these visits. It can be taken as a pandemic that destabilized the economy. The pandemic changed the way we're looking at our healthcare system, where we're not able to focus and we're not able to keep that patient-provider relationship. However, the way NeuroBloom looks at it is that this is an opportunity that we took when the concept was created to start the company. This is the time, we thought this is the time for growth. This is the time for innovation. Bring changes in the healthcare. By making these digital transformation, by using these digital methods to transform human connection, to optimize the clinician visits, to take the level of care to provide them to a concierge level, take it to them, see where they need to be, have that constant connection through using the digital visits, having follow-up e-visits, work with them, treat them where they need to be to make them more independent and safe in their community. So what if they're not able to come to us or our providers at our clinics, at patient departments? But we can go to them. We can go ahead and create this growth. We can go ahead and bring this innovation. We can go ahead and use these methods to bring this evolution from points of care to touches of care, where we can change and bring this change. What I exactly mean by bringing this technology integration for patient care, and I have as defined by the digital physical therapy practice task and the definition as it says out there, it could be anything. It could be through digital communication services. It could be through those devices. It could be anything like e-visits, virtual check-ins, text messaging, follow-ups, providing a available to your patients when they need you, when you are there. Trying to bring this practice of immediate needs, addressing those urgent needs and those concerns in the practice of physical therapy, like it has been there and it is there for patients when they need them, from a medical standpoint, to go to the urgent cares and ERs. And so what we're trying to bring in here in the concept of physical therapy is using that digital form and using that concierge care to become the urgent care for physical therapy to be available for our patients, to be available to provide them the care that they deserve, they need. And absolutely, yes, everything that I say, everything we strive to become, we do consider that there is always opportunity. These are the main seeds of growth that we look at, where we talked about how they're testing us, these opportunities to bring us for growth and innovation, and ultimately changing the traditional model of office-based care amidst these outbreaks, and using this opportunity to have lower provider burnout rates and to bring this current state of financial and economical destabilizing economy that we see by using this and bringing it to their care and bringing it to their level. What do we envision at NeuroBloom Physical Therapy? What is our mission? Just some of the pointers there, just to give an idea, but it goes way beyond this. It goes way beyond what we're striving here to do. We're here all together to become and to provide the direct, readily available access to in-person and digital forms of physical therapy, creating that environment, creating that live and real-time experience with our patients, to be able to connect with them and to be able to have that direct care and that immediate care when they need, and not for them to having to wait for months, weeks, days to see us, where they need to come in a traditional office-based clinics, outpatient department, or inpatient department settings, where they can see us, where we can be available for them when they need us to be. And this is what we're striving to be. This is where our vision is. This is what we're really working towards, to re-envision the concept of physical therapy and integrate this care by utilizing technology and by utilizing an inclusive of all the care that we can provide through concierge, where we can try and treat our patients when they need us, where they want us to be, at real-time experience, real-time settings, and this is where we are striving to be at this time. NeuroBloom is one of the ways to reach and to revisit and to reimagine, to redefine that concept of what do we need for initial assessment when our patient first comes to us, and how can we make this experience of our patient as a complete experience of the care they deserve, they need, and when they need it. And this is what we're striving to be at NeuroBloom Physical Therapy and Wellness, by also taking the wellness classes, the fitness classes, integrating all of that together to provide them that continued care that they deserve, to provide them the continued well-being and continuous, and there's a continuity of the care and the treatment sessions, so they don't feel that they're done or left out from physical therapy. Here we are providing them that care, and this is what we strive to be at NeuroBloom Physical Therapy and Wellness. Thank you all very much. This is the best way to contact us if you have any questions or concerns. If you'd like to learn more about us, please contact us at our website at neurobloomt.com. One of the best ways to reach us for any more information that you'd like about us and what we're doing and how we're striving to be where we are today and what we strive to be in the industry of healthcare is at one of the best ways to reach us through our phone, 315-447-4590. And we're based off in San Jose, California. and our plan is to surely expand and take it beyond the state of California and be available to our patients where they need us, when they need us. Thank you all very much for being so patient. Thank you. Any questions from anybody? I'm not sure where we are on the time, so. Okay, all right. Well, thank you all very much. If any questions, please reach out. Thank you.